So good afternoon, everyone. Thank you so much for joining us today. I'm Amanda Nelson with the Office of Aging and Disability Services. Today, we're excited to be joined by our esteemed presenters from American Healthcare Association, as well as our colleagues from DHHS, Maine Healthcare Association, and Maine's Long-Term Care Ombudsman Program, who have joined forces to support nursing facilities as they strive for quality improvement initiatives through QuEST. That stands for Quality, Excellence, Staffing, and Teamwork. If you need more information on that, feel free to send an email to oads.nfquality@maine.gov. And if she hasn't already, Chelsea can drop that email into the chat. We're most excited to have all of you, our nursing home partners, here today as you make the QuEST initiative promising and engaging. If you haven't already, we welcome you to drop your name into the chat. We are offering certificates of attendance for licensed administrators attending today's call upon request. Please only submit a request for a certificate if you are a licensed nursing home administrator and you attended the entire call. There's no option for partial credit. If you would like a certificate of attendance for this call, please email that email I just mentioned, oads.nfquality@maine.gov. I'm also happy to announce that we recently obtained approval from the Nursing Home Administrators Licensing Board as a recognized continuing education sponsor. So we do adhere closely to the board rules when issuing those CEU certificates, but you can feel confident knowing that we are a recognized sponsor. Today's meeting is being recorded. The recording, as well as the slides, will be posted to our rate system reform website, which will drop into the chat. The materials will also be posted to the SharePoint site and will be distributed to QuEST members via email. If you're not already getting those email updates, just send an email to oads.nfquality@maine.gov. Our goal is to share information, but just as importantly, to hear from you, our local experts. So we left 15 or 20 minutes at the end to have a more comprehensive discussion on some of the best practices that you're implementing in your nursing home communities. But if you have questions as we go along, please feel free to drop them in the chat, come off mute, raise your hand, whatever we can do to accommodate. And our presenters, Karen and Keyshawn, are happy to take those as they come up. And now I'm happy to introduce our presenters for today's QuEST call. Kiran Srinivas is the Vice President of Research at American Healthcare Association in Washington, D.C. He oversees providing internal and external stakeholders with data and analyses to support AHCA's mission of improving lives and delivering solutions for quality care. His passion is helping others use data to make informed decisions. Prior to joining AHCA, he worked 4 years at America's Essentials Hospitals on a collaborative to reduce hospital readmissions and hospital-acquired conditions such as pressure ulcers and surgical site infections. Kieran earned his master's in health policy at George Washington University and his bachelor's in biology at Northwestern. We are also joined today by Keyshawn Franklin, who has over 8 years of experience in business and project management with a specialized focus on the long-term care sector. Since joining American Healthcare Association and National Center for Assisted Living, Keyshawn has contributed her skills across the quality, regulatory, and research departments, playing a vital role in supporting both internal teams and the AHCA and CAL members. In 2021, Keyshawn stepped into a leadership role as manager of LTC Trend Tracker and Quality with the research department. In this capacity, she oversees the daily operations and strategic management of the LTC Trend Tracker system, supports key quality improvement and research initiatives, and serves as the staff liaison for the Customer Experience Committee. Her work in this role directly supports AHCA and CAL's mission of improving lives by delivering systems for quality care. Keyshawn holds a Bachelor of Science in Psychology from Howard University and earned her Master of Business Administration with a concentration in project management from the University of Phoenix. And with that, I will turn it over to Keyshawn and Karen.
Thank you, Amanda. Thank you for that introduction. Karen, are you going to share? Yep, thank you. So welcome everyone to our presentation today called From Data to Insight, Transforming Quality with LTC Trend Tracker. And as Amanda mentioned, I serve as the manager of long-term care Trend Tracker. So Karen, we can go to the next slide. So we have a couple of objectives for today's presentation that we wanted to, and hopefully we will accomplish during today's presentation. The first being discussing the importance of data analytics and how it correlates to quality improvement efforts. We hope that you all will learn how to interpret and utilize LTC Trend Tracker data to help inform those decision-making and enhance organizational performance on 5-star and VBP. And then lastly, understanding what the role of the long-term care data cooperative is in using EHR, electronic health record data, for strategic decision-making. So first of all, we wanted to kind of address why does data matter? And so we just kind of incorporated a couple of elements in where we figure why data matters is because it's an indicator of quality of care that is being provided within your facility. So being able to kind of see how you're doing, that is an indication why, that's super important. Additionally, your data constantly contributes to the 5-star rating, so which we'll go over throughout this presentation today. And as you guys know, 5-star rating that has that public display and kind of helps shape the perception of our sector. And it also helps with kind of networking. So being able to network outside of your facilities in developing those relationships. Data also helps with the comparison across PAC settings. So being able to kind of see how you're doing, not within your facility, but maybe across the country, within your state, or maybe within your region. Data also has implications both for survey and liability. So essentially, we're hoping that data helps you to figure out what story is being told about your specific center. So who is interested in some of this long-term care data? Here's a kind of a chart kind of displaying what those relationships and who's interested in seeing your data. So we've kind of put out there government accountability offices. CMS is also interested in seeing this long-term care data, different trade associations, so HCA, NCAL, etc. We're also interested in seeing those hospitals. They are also interested in seeing long-term care data, and of course more. This is just a small list of who's interested in seeing that data, but obviously consumers as well would be interested in seeing long-term care data as well. So now we're going to go into the next slide and kind of go over what is long-term care trend tracker, being as though that is the center for this presentation for today. So if you're not familiar with long-term care trend tracker, it is a web-based tool that allows skilled nursing facilities as well as assisting living facilities to be able to kind of access key information about how their organization can succeed. So you're able to kind of see how your building is benchmarking against personal metrics or metrics that your organization has set, and being able to see how you're performing against your peers. It is an exclusive benefit of HCA NCAL, so that means that there's no additional cost to being able to utilize the system. And then it also, again, focuses on those key quality metrics so that you can kind of see over time how your building is performing and build out a plan for your continuous quality improvement efforts.
Are you ready for that poll question? Or is that on the next one?
Okay. Yes, you can ask the poll question now, Amanda. Thank you.
You got it. All right, you should all be able to see the poll question.
Yes. So we're just interested in seeing, have you ever, what is your utilization of Trend Tracker? Have you logged in within the last 3 months, 6 months, 9 months, or never? Don't be shy to answer these questions, but we're just trying to, gauge where the audience is in their utilization of long-term care Trend Tracker.
We're at about 80% and slowing down. Give just a couple more seconds for y'all to get your responses in, and then you can share those results. All right. Here we go.
So we have a good mixture of people. That's good to know. So about 40% have never heard of Trend Tracker. So welcome. And hopefully the information that we go over today, hopefully we'll get some emails from you, some inquiries from you after this call today to kind of go into Trend Tracker a little bit more in depth. So we can go to the next slide, Kieran. It just talks about what does Trend Tracker do. So the three areas that we feel like Trend Tracker accomplishes is three: peer comparison, so being able to see how your building is comparison into other buildings within, again, your state, your nation. Sorry for the background noise if there's any helicopters flying over, sorry. Secondly, being able to see trends within your facility or your organization. So again, being able to answer that question of, are we getting better or worse? So seeing those trends. And then lastly, being able to tell your story. So building that internal and external trust on why your facility or your organization is where not only staff want to work, but also people want to receive care. So those are the three different areas in which Trend Tracker can kind of help answer those questions and build out a more comprehensive story for your facility and your organization. And how do you access the system? So linked here is our website. So if you were to click on this hyperlink within the slide deck that Amanda is going to share after the call, this is a web page. So you can either log in if you have your credentials, but because we have about 40% of you who have probably never even utilized the system, we will, just ask them, if you click on register, you can fill out a form that will actually have a couple of information. You can either register as a multi-facility organization. So if your organization owns 2 or more buildings, or if you're an independently owned building, you can register as a single facility building. Once our team receives that information, we can go ahead and get the process started to get you access into the system. And so that's how you will be able to register and log into the system. We won't go into too much detail about how to, the pages and all of those different things. But if you click on that web link and follow the prompts on the page, it will help you. But again, if you have any questions about how to access the system, we are always here to help as well. And we do have an email help address that I will share at the end of the slide. So Kieran, I'm going to pass it over to you to jump into our case studies. So we're actually going to do a case study today to walk through Trend Tracker and some of the elements.
Thanks, Keyshawn. And thank you all for having us on the call today to talk about Trend Tracker. So yeah, as Keyshawn was saying, we wanted to use a case study using 5-star to kind of explain how one might use Trend Tracker when trying to improve their 5-star ratings or explain it or talk to other referral partners. But to level set, make sure we're all on the same page, 5-star, the calculation for it, how it's done, sort of driven by survey. As you all know, if you quantify, it's about like 66% of your ratings based on a survey. So you start with your survey rating, then you're able to add or subtract stars based on staffing, then quality. One thing I know with providers that's been a little frustrating is that with the staffing, it used to be you could have 4 or 5 stars in staffing and be able to add a star to your overall. But in the middle of 2022, CMS changed that and moved it only that you have to have 5 stars in staffing in order to add a star to it. One of the common questions we get for Trend Tracker, but also in general in the research inbox, is about like, when is my new rating coming out? Like, when are these getting released? You will get preview reports for your ratings, but sometimes it's a couple of weeks before that. So the website itself, CMS Care Compare, is scheduled to get updated the last Wednesday of every month. With that update, it's really survey ratings that get updated every month. There's a couple of months delay between when your survey is completed. It's the state finalizes, it enters into the Casper data system, and it finally shows up on your 5-star ratings. But every month that survey data is getting refreshed, the cycles are moving, that survey cycles and stuff like that. You do need a new survey event for your survey ratings to change. That survey event being maybe a cycling off of a complaint survey or a new survey. But if you don't have any survey events, your survey rating will stay between the months. Now, the first month of every quarter, so January, April, July, and October, those are what we consider like the big update months, because that's when quality and staffing also get updated. The staffing based on PBJ data, the payroll-based journal, so that's quarterly data, and the quality, a lot of those metrics also updated on a quarterly basis. So that's why it's on a quarterly basis, those get updated. Now, that's the plan is for this, that first month, but things happen, especially the federal government in DC, we're not really operating as well as we should be sometimes as well. And so we've had things like the ratings were frozen in July of this year for a couple of months to help with, as part of the transition to the iKey system, really that Casper, the survey database, that was needing to be updated. So they did not update the survey ratings in August or July. And then in October, the release that was supposed to come out at the end of October, because of the government shutdown, the federal government shutdown, that did not happen. We have been told that's supposed to happen tomorrow, that the ratings from that release of October are supposed to be publicly made tomorrow. But this is the typical update schedule for it. A couple of these changes. So CMS keeps tinkering and changing. I kind of mentioned a couple of them a little bit earlier about the changes to 5-star. So some of the more recent ones, the health inspection rating, the dropping of the third standard survey. So in July of this year, CMS announced that they are dropping the third standard survey, but they're keeping the third cycle of complaint survey. So it's kind of a little bit of a hybrid survey cycle window. On the staffing domain, some of the recent changes, that one in July of 2022, I mentioned about how you need to have 5 stars in staffing to add to the overall. Also, we have the addition of the PBJ turnover measures and the weekend staffing measures that happened at that time period. We've also had the switch to the PDPM based acuity in July of 2024. And then, so one change that's upcoming actually is in the quality measure domain. So CMS is going to use this hybrid measure that looks at not just MDS data, but also looks at the Part D prescription claims in calculating the antipsychotic measure. And that's supposed to come into effect with the January release at the end of January of next year, 2026. Looking at it, one of the things we often at the national level at their advocacy efforts, we talk about 5-star in the ratings. There's one misconception that we kind of often have to combat when talking to representatives on the Hill or with media and stuff like that, is about this 5-star rating. And how come a question we get often is, how come there's not more people that are 5 stars? How come there's not, when I go to Yelp and Google and stuff like that, I see all these organizations, these people, these ratings for restaurants and stuff that are like if you have a 4.5 potentially in a restaurant, that's kind of like a suspect restaurant sometimes. And so we have this kind of overinflation of star ratings, and that's kind of sometimes been pushed to the perception of what we should think for nursing homes. And so this is kind of the data and the graphs that I like to show to try to combat that and kind of show some of the things of what's going on. So we have right here the main average in light blue above, and then we have in the darker blue, we have the national average. And there's a couple of, I think, points that I like to make when showing this type of data to people. One, I think, is that nursing homes, they improve. You guys are really good at, once there's a system set up in place, you take action. You put in your plans, your action plans, your quality improvement stuff, and you get better. And I think you see that with the rising of the ratings from 2010 all the way to 2015. Now CMS has set up the system that it really kind of wants the distribution ratings. They really want it to be a relative ranking system. So they do things like rebase the quality measure thresholds and stuff like that, which drops down the average. So it's not that the actual care or anything's changed in the nursing home, but it's the system itself about how they're rated that just creates this dramatic drops that you see in this. Now, going back to improving, then we do see nursing homes, they adapt. They see what these new measures are, what the new thresholds are, and they get better over time before another change happens that CMS implements. Now, CMS does want to try to reduce some of these dramatic drops. So they are trying to rebase the quality measures every 6 months. That's their plan to happen. But they do also have other changes, like the addition of the turnover measures. That's had a substantial drop in 2022. So we see that. One of the other things we've kind of seen with the 5-star system and several of the quality programs over time is a little bit more alignment. I think when I first started ACA 10 years ago, I think there were a lot fewer check boxes, in this, especially when looking at comparing the 5-star program to the SNF quality reporting program, QRP, to the Medicare value-based purchasing program. And on the far right, I've actually added also the main Medicaid VBP program. So I just kind of wanted to highlight that how we're getting a little bit more alignment with this in terms of measures, like the discharge function score that was recently added to 5-star and Care Compare. It's being applied both to 5-star, QRP, and Medicare VBP. And it's good to see. I think it helps providers, kind of align and like, all right, these are the measures to focus on. We can see an improvement in one area, can help improve your improvement with the other ones with value-based purchasing, 5-star and stuff like that. So the 3 measures I know that you all are working on with your state Medicaid VBP program is the long stay antipsychotics, the total nurse turnover, and the customer satisfaction, specifically CoreQ. I do have a question mark in there for the SNF QRP program. It was proposed at one point in fiscal year 2024, but it wasn't adopted in that program. But I think it's only a matter of time before it actually does come in some form or fashion to the quality reporting program. By statute, the program is supposed to include some type of customer reported measure and outcome, hence why that they at one point did propose the CoreQ measure, though they did not go all the way with finalizing it yet. But we've heard from CMS and other, that they are trying to figure out something. They're trying to figure out whether it be CoreQ or a CAPS measure or something that this is something that is of interest to the regulators. We're kind of the only industry that doesn't have one. Hospitals, home health, they all have some type of customer satisfaction measure. And so I think it's only a matter of time before it comes at the federal level for nursing homes. So this case study, sorry, there's probably a little bit more of a background before jumping into this case study, but this is the case study I wanted to talk about. So I found a center that with the July release, that they actually went from 5 stars to 1 star. So this is a pretty dramatic decrease in their overall rating. The center was located in New England. It's not in Maine. So hopefully you're not trying to look at each other and try to figure out who you are. It's not in your state. But I think it is a real life example. And this is kind of over the next couple steps, I want to, for the rest of the presentation, kind of go over how we've worked with providers and stuff and how they've interacted with Trend Tracker in terms of when something like this happens. So one thing is about kind of identifying what's driving the decrease. So like we're going to look at running the SNF 5-star measures report to do that. Then kind of figuring out like what are the specific measures that are driving the scores and like what goals should we set? How can we set these goals? Another thing is also communicating what happened with this change. So whether it be family members who might see a decrease in ratings or your referral partners, you're a managed care company or a hospital that might have questions about it, trying to provide some reassurance and stuff like that. I'll go through some of how one could do that with the Trend Tracker reports and benchmarking and trending their data. But once you find the measures that you can improve on, then you have your goals. That's when you would start using your plan, do, study, act, your PDSA cycles to implement your change, and then you monitor your performance and evaluate that over time. But I'm going to hand it back to Keyshawn for a little bit to kind of talk about the reports on that, and then we'll dive into that SNF quality measures report for you all.
Thank you, Karen. So on this slide here is a list of our current Trend Tracker reports that are available. So currently we have 9. As you can see, they're all kind of labeled. So we do have one dedicated AL report in Trend Tracker, and the rest are SNF specific. And they cover areas such as survey, quality measures, as well as financial data. On the next slide, you're going to see a chart that has thank you, Karen. That has all of our reports and their specific data sources. So as you can see here, some of our data sources, I did just want to call out a little bit. 2 in particular, you'll see one that says Trend Tracker users. That's going to be for the AL quality measures report, also the staff turnover retention report, but specifically for today's presentation, the SNF quality measures report, CoreQ data, that is also a data report that needs to be uploaded either by the user or the vendor that they're working with, but we'll go over that process a little bit later on in this presentation. Additionally, on this slide here, we also share the frequency of when these reports are updated in Trend Tracker. And as you'll notice, some of them note quarterly, some of them are monthly. And then those elements that are uploaded by Trend Tracker users, those are all available in real time, meaning after you upload the data into the system, you can go ahead and run the corresponding report, and that data will be readily available for you. On the next slide, we're going to walk through just how to run an actual report. So on this screen here, when you're logged into Trend Tracker, into the system, there is a menu on your left-hand side. You will just click on that Run a Report button, which then takes you to this Run a Report screen here. From this screen, you will be required to select which report you would like to run. So once you do the selections, the next slide will show you the peer comparisons and how you can select that. So this is what it looks like. So after you select the report, at the top, there is a button that you can choose. So this is more so for those organizations and users who have access to multiple buildings. So for instance, if you're wanting to just run the report for a subset of your buildings, this is where you would click on that checkbox and then select the buildings in which you want the report to run data for. But if you want to run that report for your entire organization, or if you're a single facility, you don't have to worry about clicking that button. In that blue section that says limit the peer results geographically, here is where you can select whether or not you want the report to show peers that are within your state, which is always the default for those reports, or you can change it and you can actually select the nation, county, zip code. It gets a little bit granular, but it's there for you to select. After you've made your peer selections, you will click on Run Reports. And the next slide is a screenshot of what a generated report looks like in Trend Tracker. So you're always going to see the name of the report. You're going to see your selection criteria. So that's going to show you your actual building, and then it's going to show you your peers. So whatever you selected on the previous screen will show in this section here. So as you can see, for this particular report, we chose the state level. So it's always going to show those pieces of information. One thing to highlight here, within reports in Trend Tracker, there's going to be plus signs, and this is more so for those organizations that have multiple buildings and you're selecting multiple facilities to show up in the report. If you click on the plus sign menu, you're able to kind of see how each building is doing and what their specific rates are for that aggregate total. Because in Trend Tracker, we're always going to show you aggregate data unless you're single facility. But again, I just wanted to highlight that by clicking the plus sign menu within the report, you're able to see how each specific center is doing in their specific rate. And all of this data can be exported to a CSV file if you would choose to just want to take that data offline, maybe raw data, and create your own graphics. Additionally, on this slide here, if you click on more within Trend Tracker, all of our metrics within the report has a more hyperlink, and that allows you to see more historical data and to give you more of a visual look of the data. So Karen, you can go to the next slide. So this is what you see when you click on more. That more hyperlink, you're able to see a graph and or chart, depending on which report you're actually running and the measure that you're clicking on for more historical data points. You'll either see a line graph, which is shown here on this slide here, or bar graph. So those are the two options that we currently provide in Trend Tracker. But as you can see here, instead of the 4 data points that were shown on just the report summary, now you're able to see more historical data points. Again, this might be of interest if you're a quality award recipient or quality award applicant who's wanting to maybe include some data elements into your application, or again, if you're wanting to share these slides, you can simply just print and export these charts directly from Trend Tracker, and you'll be able to download those to your computer as well. I saw a question in the chat.
Yeah, the question, Keyshawn, is are Trend Tracker reports, including AL Core Q results, available for assisted living facilities that are private pay, so they do not accept Medicaid/Mean Care?
Karen, I believe so. I don't think that should matter if they're private pay or not. Core Q is just, that is a non-mandatory field in Trend Tracker, so that's just your customer satisfaction information. So if you wanted to work with your Core Q vendor, you can do that and they can upload the data on your behalf. But the pay piece doesn't matter as far as being able to upload that Core Q data within the system. Thank you for your question.
Keyshawn.
Of course. Karen, you can go to the next slide. Also within Trend Tracker, there is an ability to customize reports. So you are able to actually select which measures that are offered within that report and the time frame. So for instance, if you're within the SNP QM report and you're not, as you can see on this slide here, there's core Q elements that are automatically included within that report. If you're wanting to not, look at the core Q information, but maybe focus on your quality measures, you can absolutely deselect those measures and then just run the report again. Essentially, the idea behind being able to customize reports in Trend Tracker is being able to allow users to see and focus on those measures that they want to focus on and not really get hung up on those other measures. Or if they want to see the report being run for a specific time frame, maybe instead of 12 months, they want to actually see the data over a 6-month time period, they're able to do so. So we really like to highlight this feature for potential users of Trend Tracker so that they can see that these reports aren't always stagnant, that they can actually customize them and make them a better uses for whatever they're needing to utilize that report for. And then lastly, when it comes to running reports in Trend Tracker, again, the ability to export. So as I mentioned before, on the actual report page, you're able to export to CSV. So that's just raw data that you're able to export from the system and maybe create your own graphics. You are able to export these reports as PDFs. So if you wanted to maybe drop them into an email that you wanted to share with your team, you can do that as well. And then as I mentioned before, being able to export those charts, which is those graphics. If you click on export chart, it will just download as an image that you can include, again, presentations, applications, emails, etc. So those are the different export features that Trend Tracker currently offers within our system. So now I'm going to pass it back over to Kieran, where he's going to walk through being able to run our 5-star measures report and our case study.
Thanks, Keyshawn. So in this screenshot, so I've taken that center that we had that drop from 5 to 1 star, which you see in the blue right here. So, and this is kind of running the 5-star report within Trend Tracker. And so this is kind of the report summary at the top of the page. And so we have here under My Centers, this would be that center. And so here we see that the third prior period referring to June here at the bottom. They had a 5-star rating and then that dropped to 1 in July of 2025. Now, if you go down, we see the health inspection and the other boxes that I've highlighted, the direct care staff, the staffing and the quality measures. This center actually it took a punch on each of them. In the health inspection, they went from 4 to 2 stars, and staffing, they went from 2 to 1 star. And the quality measures, they went from 5 to 4 star. So with all that combined, they used to be able to we're adding a star in the quality measure. Now that it's as a 4-star quality, they're no longer gaining that star in quality. They also, with the 1 star in staffing, they're losing a star. So that's why their 2-star in survey goes down to 1 star overall with that. Now, something, to highlight that, when looking at this, if, people start questioning or when people question about it and ask about it, for quality measures, for example, you do see the drop from 5 to 4-star, but they are still above their state average of 3.18. And so there are always, I think, a little bit of bright spots, within whenever something happens like this. And sometimes those are important to reassure when talking to your stakeholders, to reassure them about some of these things. So wanting to go a little bit further, this is, if you're clicking more, this is kind of, you see that graph. So this seems like a little bit more of an anomaly, kind of dropping down to 1 star. They've had quite a year-long reputation of being a 4 or 5-star building, but it's this really more recent thing of dropping them down to 1 star. One thing I'll also highlight on the bottom, when you do run it for one report, you are able to see percentiles. So you're able to see percentile ranks within your state and the nation. I know a lot of cut points for different programs and stuff are based on percentiles, and so this kind of gives you a nice. Not so much with 5-star because it's just 1 to 5, but when you're looking at readmission rates or other things, to be able to find that percentile rank is helpful. So let's jump to the staffing range. So trying to figure out what, in that one report, we have sections for kind of each of the components: survey, staffing, and quality. And so if you were to scroll down in that 5-star report, what you'll see the staffing section. So here's where we can try to understand what's going on with their staffing rating. What amongst the 6 measures, the 3 turnover measures and the 3 HPRD, the hour per resident day staffing measures, what's happening and with that. Well, one thing, so we kind of see from this is it's really the HPRD measures that they're that are driving this. So from Q4 2024 to Q1 2025, they had a drop in both their total nurse HPRD from 3.21 to 2.97, and subsequently their weekend also dropped from 2.83 to 2.63. Now their RN adjusted HPRD, it remains steady, 0.60. And I think that's, another thing to kind of reassure people, hey, our RN staffing is staying the same. I know our staffing rating dropped, but we are still keeping our RNs there, and we know that RNs play a crucial role in providing quality care. In turnover rates, they are seeing improvements in that. They're seeing the total nurse turnover rate, they saw that decrease from 69.7 to 63.2, though they are still above the state rate, the state average. So, there's still some potential room for improvement for both the total nurse and RN staffing. I think one thing that's also helpful, these star ratings are it's very hard, they're snapshots. So like we talk about, these are July ratings, but it's based on staffing from Q1 2025 or Q4. And so understanding that kind of how they're rating today, what specific time period it aligns with is kind of one of the other things when looking at the individual measures and looking within the 5-star report. That's helpful. Next one of the other things I think that's helpful in terms of helping people understand their 5-star rating is actually looking at the top line report. It's probably one of our more popular products within Trend Tracker. It's this publication that comes out, and I think we might have a poll for that as well. Yeah. Amanda, do you want to start that poll, or do you want to? Yeah, thank you. So just wanted a quick poll about like how many people have you received a top line? Maybe you got it yourself directly, or I know there's about 40% that hadn't logged into Trend Tracker recently. So maybe you got it forwarded, top line report, or saw it from somewhere else. So it'll take a couple seconds to answer that question. But as people are answering that question, I can go ahead and talk about with this slide and like kind of what is the top line report. So it's a PDF summarizing your facility's 5-star ratings. It's updated quarterly, kind of along that basis of what I meant to talk about earlier about how quality and staffing ratings are updated on a quarterly basis. So we really try to utilize when that release comes. So ideally, end of October is when we get that last, update for the year. And so we try to get out early November. The delay from CMS and the federal government releasing the data, we haven't released the Q4 top line yet, but with tomorrow's release, we hope to get the Q4 out next week. It's sent out via email, so you get an email knowing when the report's new. I think people appreciate that as opposed to having to log it to see if there's a new report out. You will get it, in your inbox when and there's a new one, and then you can go directly to. Once you see the report, you'll get an email about it. You can click directly, and then you'll get that PDF directly. All right. Thanks, Amanda, for sharing the results from the poll. So we got 50-50 about seeing a top line report. And actually, Amanda, one thing I'll do is maybe I'll include a blinded top line report in the handouts and stuff. So maybe we can upload that along with the slides and stuff for people.
Oh yeah, I'd be happy to. And just a reminder too, we have a lot of directors of nursing and administrators on, but we are lucky to also have social workers, activities directors, so very broad audience. So it's not shocking that we've only got 50-50 on that.
That makes sense. So one of the ways, the ways to access the publication, the top line, if you are, and then you haven't seen it, then on the left-hand side, we have this subscribe to publications. You'll go there and you'll be able to select which building. So maybe in Trend Tracker, you only want to get the publication for a specific building. You can be able to do that here and subscribe to that specific building if you want to. But you can always pull up historical buildings. So there's also a view and download a portion on the page. And so you can actually pull up historical top lines. And so going back to this case study, I think one of the things that's nice maybe is actually comparing, all right, I got this new top line that shows me having a 1-star, but let me compare it with the previous top line that will have me at a 5-star, and I can look at the two compared, which I'm going to do actually next in the next couple of slides. So here's the most recent, that Q3 top line. And actually, so one of those things, this center had this drop in their survey going from 4 stars to 2 stars. It happened to coincide with a couple of things. One thing is this new methodology change that I mentioned earlier about CMS moving from three standard surveys to just 2 standard surveys, but still keeping a complaint window of up to 3 years with it. And so within the top line, we try to explain these changes when they happen and try to provide some context. One way we've had providers like to use the top line is actually they'll take the top line and they'll share it with their board. So for their, whether that quarterly board meeting or whatever, they found that it's an easy way for them to just keep their board up to date on what's going on with the 5-star and stuff like that. Because it kind of provides a little bit more graphical, version of what's going on, and some information about it. So the changes, and so here the center is able to see like where the center is now, and how within their state they need to have less than 18 points in order to be a 3-star to have that increase in star rating. We provide some a little bit more detail on the far right, talking about the other thing that happened with the center is they actually had a new survey in May of 2025. This was the first time that survey became available. So that also had a little bit more deficiencies with that survey. And so that's the other reason why having a larger drop, but of how the weights are applied, how the scoring's done, it's kind of all shown here. The other things that might impact your rating, whether you have the abuse icon, things like that, that's also shown within the top line report. Talking about that staffing, the decline. So here on the left-hand side, I have like the prior one where they used to be at 2 stars, and then on the right-hand side, I have the newer one based on 2025 Q1 data, and this is where they're at 1 star. And essentially, it all boils down to they lost 10 points, and that's what happened with their staffing rating and why they went from 2 to 1 star. And so sometimes explaining something like this, like it was 10 points that lost us the staffing rating, can be somewhat reassuring sometimes to people about like what happened. Like it's not, there was, yes, we had a decrease in some of our staffing, but it wasn't a huge substantial one. It resulted in something that where you only lost 10 points out of the 380. So providing that a little bit of reassurance there. But here we kind of go through with the PDPM calculations. I know it's been a little bit complex and trying to understand like how is it being calculated. It used to be a little bit nicer with the rugs in terms of understanding. You could be a little bit more, I felt, predictive about like based on my patient population, I kind of know how much staffing I need in order to get and what that would translate into my rating. It's been a little bit more, I think, harder with the staff turnover measures and all that are being applied. But within the top line, we kind of walk through that. We walk through what's the national average that's being used, how is it getting calculated, and so this is just a snippet from that, kind of showing how they're reported actually decreased. Actually, they're reported so they're reported for RN increased. So they went from 0.65 to 0.698, and they're reported, but their total nursing did decrease. So their CNA and LPN had some decreases. So they went from 3.49 to 3.42. But the reported didn't go down too much, but it's also the case mix went up. And that's the other thing that drove down and why they got fewer points. So they used to get 30 points in their total HPRD, and they're down to 20 points with the 2.9. So yeah, we walked through those calculations for them. On the quality side, we also saw that they had a decrease. They went from 5 stars in quality to 4 stars. So on the top line, we do a snapshot. We put all the measures that are contributing to it. We have the short stay up top and then the long stay. And I've highlighted a couple of the measures. These are the ones that they had the largest decreases in. So in short stay ED visits, they previously had a rate of 5.9% at 135 points. And then they went down to, their rate went up to 8.9%, which results in the 75 points. So, and then QR pressure ulcers was another measure that they had a fairly substantial gain from 2.3% to 4.2%, which they lost another 20 points from that. So within it, we kind of walk through the calculations, how the short stay, there's a weight applied because there's fewer short stay measures, how that's applied. At the end of it all, though, they used to be at 1,503 points. Now they're down to 1,432 points. And that is just below the threshold of 1,456 that they need for 5-star. And so from this, you might want to go into like, all right, so where's the opportunities to improve? Maybe it's within the ones that dropped a little bit, but maybe it's something else like long stay fall, where they have this the red dot indicating that they're pretty low in scoring points on this, and they have a high rate for that. All these specific cut points and stuff that they have that we apply, they're all coming from the 5-star technical manual. And we provide links to that within the top line report so people can, access that within it. I am going to actually jump to another way of actually using the predictor tool for this. I'm going to stop sharing for a second as I pull it up on my screen. So separate from the top line, we also have this predictor tool within Trend Tracker that allows you kind of to a little bit more dynamically play with the numbers that show up in terms of the quality measures. And so let's.
While you're bringing that up, we do have one more question too. And I think you kind of touched on this a little bit, but it says there appears to be a lag between nursing home CMS's 5-star rating report and IKEY's and the LTC Trend Tracker report. And what are your thoughts on that?
That's a great point. And I'm also thankful that you're actually looking at the IQ's report. So that is going to be the most real-time data you're going to probably get from that. And maybe your EMR vendor is able, or you have an analytics part that's able to do some more real-time, providing some stuff like that. But we are limited, with our data sets. We kind of have to wait for that CMS Care Compare release to come out before we're able to update it. So there is a lag between that. So once the data does come out publicly, we're able to get it within a week or so onto Trend Tracker, but there's going to be that lag. And unfortunately, it's going to kind of remain. There's not much we can do to reduce it.
Got it. Thanks, Karen.
And let me share my screen again. So once you log into Trend Tracker, on the left-hand side, we have this 5-star QM predictor tool. And once you're there, you're able to select your building. So I've gone ahead and already selected the building that we have this case study on. It loads to the default to have on the left-hand side, we have the current performance. So, they have 4 stars in their quality rating, but then they're in the subdomain of short stay, they have 5 stars, and then for long stay, 3 stars. And here are the points and what they're earning for each of them. These are all shaded kind of accordingly to what they are. So for example, the short stay ED visits we had talked about a little bit earlier, they're 8.9%. They're, just above the threshold. They need to be 8.6 in order to be gaining 90 points. So on the right-hand side, we talk about the goals or the next cut point. So this is where you can kind of play around and modify and see if I scored a specific rate, if I set this target, how would that impact and how would that result in my points for the star rating? The default is set to show next cut point goals. So it's kind of just score the next point threshold for each of them. But we can go ahead and I'd like to start if you were trying to figure out where an opportunity to go. I think setting it as clear is helpful to start with, and then kind of playing from there. Going to the example of the falls. So the falls is the one in red here is where they're earning the fewest amount of points, 20. So if we set a goal, if we are able to get to, 4.5%, so kind of be within that 40-point threshold, we enter that. So that means we're going to be earning 40 points in this. And then we see what that does here. So that makes our total points for long stay is 640. Yes. And then we also have our total goal points here at 1,452. So we're still not quite there to be up to 5 stars. We still actually need to add more points. And so there might be what are some other measures we might want to either we've been working on maybe that we think can be, improving, maybe worsening mobility. That's something we can do. But it also seems like this facility has a lot 5 stars in short stay. So maybe short stay is really where their focus is at and where they kind of a lot of their efforts are being played at. So maybe it's actually somewhere in this realm. Short stay antipsychotic medication, for example, maybe it's about trying to reduce that seen from the hospital, the relationship in terms of antipsychotics starting and stuff from the hospitals, can we get this down a little bit? So if you did 1%. and or I guess if you less than 0.8%, you'll be up there, and so you'll see how it plays out. And so you can, once you set these goals, you can save them as your goals. If you're at the at the org level, if you have multiple buildings, you can actually set org level goals. So if you want to set it for individual buildings, you can go do that, and you can see kind of what the org potentially set for the organization, how you are faring with those. Let me. So yeah, here's some screenshots of it that we wanted to make sure you had, but we thought the real life demonstration would be a little bit a more engaging way. So moving on to thinking about, so once you know kind of what's driving it, how do you, some ideas for diving deeper and improving on your quality measures. One thing that people I think don't realize that with Trend Tracker, then I think they might overlook a lot is about the 1/4 rates that are available. So Keyshawn showed how when you're in the quality measures, you can go and click customize. And while the 5-star ratings are dependent on 4-quarter measures, the 1/4 measures can be very helpful in kind of identifying emerging trends, engaging the performance. So within that customized screen, you can go ahead and click the 1/4 rates and then see them and graph them out. And so, for example, here's with the falls measures, looking at how they're doing on a 1/4 rate, you kind of see some. It's kind of there's just a couple quarters that kind of are a little bit stand out and are worse than the rest. So it's more like, so maybe it is kind of realistic, kind of seeing like, there's some rates where there are months where we're getting the blue, like we are below 5%, stuff like that. So maybe a goal of like 4.5% is realistic, in terms of that, and we can set that. Maybe it's those months that are the outliers, like maybe what's going on with that, like can we go back and do some root cause analysis, figure out what happened in Q2 2024, Q1 of 2025, figure out what's going on there and replicate it going forward. I know I'm a data person. I think I feel like I said numbers a lot in this presentation and that, but at the end of the day, I think a lot of our staff and stuff, what we do, the reason we are in this field, that we work, especially people on the front line, they work in the fields, it's not for the numbers. It's not to reduce, get a specific rate of falls that are less than 4% or something like that. It's the human component, like why you're in here. You're here to like take care of the residents in there. You're also there to help each other out. I have a newborn at home that's it's under a year, and Keyshawn's been so helpful for me in terms of like balancing out, helping me, and covering for me in several things. So some of the work I do is for my coworkers as well. And so I think when working with with your teams in order to improve that, I think not losing focus of that why and what you're trying to do, whether it's for coworkers, for the residents and stuff, I think can really be impactful and be meaningful, rather than thinking about sometimes these goal targets. While they're important and stuff, and I think and they're important, they help move that to get that goal. They're not necessarily the reason why the audience, your actual staff is working and wanting to make changes into their processes and stuff like that. And so when we're thinking about like, all right, I need to get this percentage though, like I need to get below the certain percentage. I think that's where we kind of come into thinking about using some of those other reports that someone already mentioned in the chat, talking about that iKeys report. I think that resident level, report where you're able to see which specific residents are triggering the QMs and kind of convert like falls rate. You get 5%. Well, it's Smith and Jane, and like who is it specifically that we're trying to reduce the falls for, and seeing that they trigger the falls. I think creating that human component can be kind of powerful and motivating for people. So we do kind of we try to think about using those iKeys reports in partnership. We think they can be used in partnership. If with some of the trend track reports, like some people like we use the top line to provide that summary, that high level summary that we can kind of use to communicate. But then we kind of use more of the iKeys reports when we talk about or quarterly rates and what they do. And so you can find, I think try to figure out what works for you in the relationship with using Trend Tracker. I think, the QM report is the one, and we might have a poll question actually for this.
Yeah,
I think
pulling it up now, Karen.
thanks. Yeah. We were just kind of curious to see, how many people have you accessed an iKeys report? I don't know, maybe in the chat, you can also maybe share like what's your favorite iKeys report? I know there's a lot of them that are out there, from staffing to quality measures and stuff like that. You know, as we're not a provider, as association, we don't have access to them. It's only, you know, you at the facility that actually are able to access them. But within them, actually, I'll pause and let's finish the poll. We're going forward.
We've got about 65%. If you haven't gotten your answer in, we'll leave it open for just a few more seconds. Trickling in. All right, 5, 4, 3, 2, 1. Here are the results.
Awesome. So yeah, so 65% you have used one, have seen one, have accessed one, and 35% haven't. But there's quite a few in there. The resident level QM1 is one I think related to 5-star that's quite helpful because you can actually see specifically which residents, you know, they are, and if they're triggering it, you kind of see, you know, amongst all the QMs that are out there, you know, you get these codes about is it being triggered, you know, the C complete data, or B, you know, the B not being triggered, or X being triggered for it. And so kind of identifying that help, then you can then do some root cause analysis and do some more creating that human component again to what you're trying to improve on. All right. So with next, I kind of want to move to Core Q, and I'm actually going to hand it off to Keyshawn to talk more about how the Core Q data that's available in Trend Tracker.
Thank you, Karen. So to go over what Core Q is, which is the next slide, and getting to the core of customer satisfaction, because that's essentially what Core Q is. It is a standardized set of 5 customer satisfaction measures for SNF and AL communities. And the purpose is to consistently assess satisfaction across long-term care impact settings, PAC care settings. So that's essentially what Core Q is all about. And then why utilize it? So Core Q improves care by creating a feedback loop. So that's between the resident and the family directly to the staff. So being able to have that constant communication about how your facility is actually performing and how your residents and families feel like you guys are performing on those questions that are asked in that survey. So hopefully you can make better decisions about, you know, actionable insights, driving some quality initiative, and of course, fostering a culture of accountability, because, you know, we all know that we try our best, you know, at all times, and sometimes that's not always relatively received. But if you can get that feedback from that family member or that resident on how you could potentially do better on the customer service side, again, a culture of accountability. I know me personally, I would prefer somebody say sorry than act like nothing happened. So essentially, this is what Core Q was all about, that getting that feedback from your residents and your families, and then being able to have that actionable insight is always a good thing to have. On the next slide, next couple of slides, we have some rates or just some data about Core Q and how this data is in Trend Tracker. So as I mentioned before, there's 5 data elements. So we have 2 that are specific to AL, which is family and resident surveys, and then 3 for SNF. So family for long stay, resident for long stay, and then short stay resident. Those are the 5 different areas for Core Q and how they're captured in Trend Tracker. For the purpose of today, I just included some data elements on 2 areas. So the first one being long stay family. So as you can see, these graphs here show the satisfaction rate. So I can say that Maine, you all are doing absolutely phenomenal when it comes to the satisfaction rate. For the state, you guys are above the national average, as you can see here, 93% compared to the national average of 77%. And your response rate is above the national average as well, being at 100% versus the national average, which is about 65% here. The next slide goes into long stay for resident level data. Thank you, Karen. And again, Maine is performing better than the national average. So long stay residents, they are having an 88% satisfaction rate within the state of Maine. And then as far as the response rate, again, you guys are above the national average as well when it comes to that area. And this is all pulled from Trend Tracker. So the next slide is going to talk about CoreQ in Trend Tracker overall. So one thing I did want to note, and I kind of mentioned it earlier in the call, is that CoreQ data does have to be uploaded into Trend Tracker by participants. So again, an individual user, org level user, or you can work with your CoreQ vendor, so your customer satisfaction vendor, and they can directly upload that data into Trend Tracker on your behalf. The data that is collected, as I mentioned before, when it comes to assisted livings, we're looking at families and residents, and SNF is short stay, long stay for family and residents. The data that is displayed, so CoreQ data within Trend Tracker is shown within the AL quality measures report for the AL data, and then the SNF quality measures report has the CoreQ data for SNF. And if you want more information about, who your CoreQ vendor options are, you can always visit the CoreQ website. It also shows the methodology that goes along with it. Just to put this out there, because we kind of talked about him earlier, Nick Castle, we worked with him to develop this. So that is also available on the website. And then we also have a CoreQ. Yes.
Kashan, it's Mo. I'm sorry to interrupt you.
Hey, Mo.
Hi. I just wanted to let all of our members know we are currently vetting vendors for CoreQ, and we thought we'd have that information ready this week, but we have one more vendor that we're having a call with on Friday. So we will have that list to people as soon as possible. And I apologize for the delay. We thought everything would be ready to go, but and again, people can make up their own minds who they choose to go with. We're just trying to vet several providers and several vendors so that you all can then make an informed decision.
Thank you, Mo.
Thanks.
You're welcome. And then in addition, you are always welcome to email the CoreQ inbox here at HCA as well if you have additional questions about CoreQ and how we can help with that, that relationship between the vendors and getting that information into Trend Tracker as well. So on the next slide, I want to kind of walk through high level of how you get this information into Trend Tracker if you're choosing to upload this on your own as a provider user. So on the left-hand menu, you'll just click on Upload Data, and then you'll click on the CoreQ survey results upload. We do provide all of the templates for you, so you're not having to go and look for a template. We do provide those within the system. So depending on which CoreQ results you want to upload, that will be the template that you download to your computer. You'll fill in all of the information that it's asking, and then of course you will upload it into the system. So as long as you do not have any errors within your upload, you'll be able to submit this information as final. And as I mentioned earlier in the presentation, once you upload your CoreQ data successfully into Trend Tracker, you will get a prompt that says that it's been uploaded successfully. And then you can go to either the ALQM report or the SNF quality measures report, and you can see those CoreQ results data immediately within those reports in Trend Tracker. So it'll put it in there and make it look all nice and pretty for you if you need to, share that with any of your stakeholders within your organization or outside. So moving on to another data solution with HCA and other partners is our long-term care data cooperative. And so what the data cooperative is, it gathers some clinical, again, electronic health record, EHR, from different EHR vendors on the provider's behalf. And so the idea is for the data that is collected to be used for healthcare operations. So you will receive feedback reports for your own facility with data provided in there. Public health surveillance. We do offer research on effectiveness and then clinical trials. That is kind of what the data cooperative is. It is provider led. So it is based off of what the providers provide to be captured within this cooperative, and hopefully being able to have that relationship with different researchers, etc. So how it works is that there is no cost. So it is free free for providers who are wanting to participate within this cooperative. There are some legal agreements that must be signed before you are actively participating in the cooperative. So you will have to sign those data agreements. And then as far as data usage, so the AHCA analysts, we actually use that data to support healthcare operations, and the data is free to use within any US-based eligible researcher who proposes eligible studies. So again, we don't sell the data, and there is a vetting process. So researchers do have to submit proposals that then get approved by a whole committee that goes through a whole process before they can actually access any of the data. And then as far as security, the data is hosted securely in an infrastructure that is trusted by CMS. So on the next slide, this is an example of a provider report. So this one is for the Advanced Directives report. And so this is what a provider report will look like. It is a PDF that is sent out. And so you'll see information about your facility and how they are performing when, on that specific area. I believe there's a few different report types that the team is looking to send out in the future, but just wanted to provide an example of what a report would look like for a provider who is participating in the data cooperative. On the next slide, types of data that is included within the data cooperative or collected for both SNF and ALs is diagnoses, medication. I wanted to include that because I know that that's included in the main VBP, including antipsychotic medications, so vitals, lab orders, vaccination administrations, any allergies, advanced directives, and assessments, including MDS data as well. So the next slide is a map that shows participation of the data cooperative, which has really, really grown. So as you can see, as of July of this year, we have about 2,600 different SNFs that are participating within the data cooperative, and about 750 different ALs. So this represents about 180 plus different organizations in the country. And we don't have any participation from Maine yet, but that does not mean that we won't. Which is the reason why we wanted to bring this to you all today. And the next slide just shows more information about how you can be involved. And so, as I mentioned before, organizations that hold the contracts with the AHR vendors enroll on behalf of all of their SNFs and assisted livings on that particular vendor contract. To prepare, you do have to have a participation agreement. So if you're interested, you can always send an email to the link provided here, which is the LTC Data Cooperative email address, and the information provided here that you will need to include in that email. But again, if you have any particular questions about if you're missing certain data elements or anything that's being captured within this participation agreement, feel free to reach out to that email that's listed here on the slide, and they will be more than willing to help you. The next slide just goes over some of the partners that are involved within the data cooperative. So this is supported by NIH, so NIA, but the National Institute of Aging is also. Matrix Care is one of the vendors that EHR vendors, of course, AHCA, NCAL, Brown University, Point Click Care, and Acumen. These are the different partners that are incorporated within the long-term care data cooperative. And then lastly, I have provided some information. There is a link that goes straight to the data cooperative webpage. And then again, if you're requesting any type of materials, meetings, if you want more information about the data cooperative in general, the email address is also provided here as well. So to kind of close out our presentation for today, we did just want to highlight a few resources specific to Trend Tracker. So there's a few ways that you can access resources. The first being on our webpage, which is provided in the link within a couple of slides in the intro slides. On our actual webpage, we have a resources section on that page that has help documents, some videos, as well as some AHCA NCAL Ed one-on-one trainings that walk through different parts of Trend Tracker that you can access. And you can always access the resources page within Trend Tracker itself. So if you're ever in the system and you're in a report or you're on a specific predictor tool within the system, you can just click on resources and it will take you back to our resources page. And we also have a help link that is on this screen here as well. If you were to click on that help, it is a whole entire help guide that walks through every single page of Trend Tracker, the definitions, all the metrics that are incorporated within different reports as well. So we try to put the resources a couple of different couple of different places so that you're easily able to access them. But of course, we would love your feedback if you're ever in the system and you're like, hey, it will be nice if we have resources on this section of the web page. Please feel free to send those over to our team. And then the next slide, I've included some direct email contact information. So again, Karen and our email addresses are provided here. If you ever have any questions that you would like to, direct to us immediately, we can do that. And then on the right-hand side of the screen are different inboxes. So we do have a dedicated research inbox for any research inquiry that you may have. We have a Trend Tracker help desk here. So any inquiries about how to register or access Trend Tracker, you're not seeing reports, whatever the case may be, Trend Tracker related, please feel free to email us at help@ltctrendtracker.com. And then lastly, as I mentioned before, the Data Cooperative team, they also have their email address, which is also provided here in this slide. So I guess we can open it up right now for any questions that you might have. I know a few of you have asked questions throughout the presentation, and we really appreciate those questions. But if anybody else has any additional questions they may want to ask, feel free to do so.
That was really great, Karen and Keyshawn. We covered a lot. That was a lot of information, all very much needed. That was terrific. One question that came up in the chat is about CoreQ. And this participant, they've been doing the CoreQ survey for years, and they've asked their vendor to upload it to the AHCA Trend Tracker. And she's not sure why that hasn't been happening, but she's suspicious it might be due to small numbers. Do you know if the Trend Tracker prevents certain surveys or facilities from being uploaded due to small numbers or anything similar?
Karen, do you want to take it? Or do you want me to take it?
You can take it.
Yes, so there is a limitation. So the number of respondents, then the data will not show up in Trend Tracker. So the response rate does have to be above 20 in order for the threshold to be met for data in Trend Tracker. Karen, am I missing anything when it comes to that?
Well, yeah, but I think you could still upload it if you're below it, but it wouldn't be included in the peer comparison for
That's
it.
what it is.
Yeah, if it's below that. But it should be, I mean, I think Mo mentioned like sharing the vendor, like we do have a vendor work group, and we're trying to like work with vendors about this. So try to understand like it improves some of this. I think there's some kind of confusion about like how is the sampling window calculated, how it's set up. Like there's multiple ways about making sure that you're able to actually get enough a sample size that you're able to get it in there and actually meet these thresholds in order to be able to enter data that's the valid and reliable.
I think what's interesting, and I see where Cheryl's going with this, where this is now going to be, it's not going into the peer group. So it might be something, Karen, that we need to talk with you and maybe Valerie about, and also maybe get Brooke from the state involved so that we can figure that out. That's a really great point, Cheryl, that you're bringing up.
Yeah, that would be helpful to make sure that all of the folks who upload their data are included in the state benchmark. We have a lot of, it's a minimum 20, if I remember right, from Dr. Castle, 20 responses, which for, a building with 26 beds is literally impossible once you go through, making sure that you have all of the folks that meet the criteria, have an appropriate BIM score. The state of Maine has opted to a couple of opportunities to increase the response rate per request on these calls. We are allowing folks on hospice to participate in the survey because many people on hospice are able, to speak and make their needs known and and all of that, and have a you know, appropriate MIM score. We're also including public guardians. In some states, those folks are not very involved. In our state, you know, they have a requirement to be involved, and in some cases, they're more involved than biological families. So some exceptions there. And then Cheryl, specifically, there have been some allowances made to make sure that smaller facilities aren't penalized, smaller bed capacities. So it's based on if you have the 30 eligible residents, you have to have at least 30 eligible residents to be able to have 20 responses. Is kind of what we came down to try to make it a little bit more fair. It is on our list too. There have been some minor tweaks, like the things I just mentioned, that have been made outside of the manual, and we're working to compile a list, and maybe Maine Healthcare Association is working on that too, based on information as it's been shared. But we anticipate being able to share any of those little tweaks in the very near future, just based on the questions that have been asked for clarification. We want to make sure everybody has the answers to those.
And I think with this, Karen, it would be you that I reach out to talk about this further, or reach out to Valerie, or who's the best? Okay.
You can, I mean, I reach out to Valerie myself. You can do both of us.
Okay. Yeah. All right. And I'll, Amanda, I'll circle in with Brooke as well, so she can be a part of that.
Yeah, that would be great.
That's great information, guys. Part of what we've been looking at as we're vetting vendors is, what are you going to do to help our members get the response rates that they need? Because we know how important that is. So awesome. Thank you, Cheryl, for bringing that up.
And also allowing the phone surveys. I think that will really help to get those response rates up too. Yeah, I think the kind of the flexibility that, you know, we've received feedback from the QuEST members and kind of made those flexes. I think it will help significantly to get the response rates up, because that was just something really specific. Nobody wants facilities to be penalized simply because of their bed capacity. Other questions for Keyshawn or Kieran? Let's see, 30% is considered a good response rate. Rather than having the requirement be 20 responses and a 30 response rate, could it be one or the other? So yes, in the instance when you don't have 30 eligible residents or 30 eligible family members, because you've got both surveys to complete, right? In that instance, if you don't meet that threshold for having 30 eligible, the state of Maine has flexed and said, okay, if you don't have 30 eligible, then you're not likely to get 20 responses back. So in that instance, you would still need the 30% response rate, but not the 20 surveys. And let me know if that makes sense, Kim. And like I said, it might be a little bit more clear too when we issue some written guidance on that. What other questions for Kieran or Keyshawn, or in general? Any kind of best practices that anybody wants to share for anybody who's been doing the CoreQ survey, or maybe if you've been using LTC Trend Tracker right along, or one of the other tools mentioned? Anything you want to share with your colleagues on the call? Or if we missed any questions in the chat, please feel free to come off mute. Let us know. Okay, so that's a lot of resources shared. In addition to the slides, we'll be sure to share that redacted top line report for anybody that hasn't seen it. It's really great. It's a really great tool, and that's exactly what I used to use it for, Kieran. I used to use it for my board presentations because it was much easier to explain that, you know, because it is complex. methodology. It's certainly not an easy thing to navigate, even when, you know, for folks like us who are the you know, at least the operationals, ops experts. So I have put both links to both surveys into the chat, but we're gonna start out with the November QR code survey on the screen. So this is for the session that we just participated in with Karen and Keyshawn. If you could click on that, or I'm sorry, scan that QR code, but I did put the links into the chat too, if that is easier for you. But we just wanted to thank you all for coming. We do have these two surveys. Like I said, the first one is to gauge today's QuEST call, but you can check out the link if you prefer. We'll give you just about 2 minutes to get that survey done for today's call, and then we'll put the second survey up. So for anybody who joined a little bit late, we had shared this at the beginning of the call. This is to rate the overall feedback of the QuEST educational series in 2025. And we do value your feedback for 2025, but we're also really looking for what you'd like to see in 2026. We anticipate that 2026 is going to look a little different, not necessarily so structured, taking turns between the making sense of VBP, dementia care partnership, and culture change topics, but more just what you would like to see, what would be the most helpful for you, as well as you know, how frequently you would like those calls. Is monthly too much? Would you like to consider every other month or quarterly? Is 90 minutes too long? Would you like them to be 90, 60, whatever you think? Or if you're not going to participate if you don't anticipate participating in the calls, you can let us know that too. But please do complete that. We can switch over to that one now. I think everybody's had the opportunity to do the November survey. We can switch over to that one. Today's recording and slides, just like always, will be posted to the Rate Reform site. I'll drop that link in the chat in just 1 minute too, in case you don't already have it saved. They'll also be posted to the SharePoint. And as always, we'll send them out to everybody that's on the QuEST email list by email. There's a lot of really great resources in those emails, so make sure you check them out. Links to everything. We'll leave this slide up for just a few more minutes so that everyone has a chance to answer. But if you're all done with the surveys. Oh,
Amanda, did you see that in the chat that someone can't open the link to the survey for November?
Okay. Was that one person?
Looks like it. That's so far, that's what's in the chat. Anyone else having a problem with it?
I'll click it right now just to say it comes straight up for me. There's the link and the QR code. I will say that the link to that survey does come out in the wrap-up email too every month. So if you get it in the wrap-up email, we leave that open for a week or 10 days after the email is sent out. If it's still not working, let us know at that odes.nifquality@maine.gov inbox. But if you want to try the link in the chat, it should work. And thank you for letting us know that too, Louise. So if you've already completed both of those surveys and you're all set, then I just hope that you have a wonderful day and a happy and safe Thanksgiving. And thank you all for joining. Thanks so much to Karen and Keyshawn for the great information today. You guys were awesome.